Did you know that more than 50 new cancer therapies have been approved by the FDA in just the past 5 years? But in order to take advantage of many of the new and emerging cancer treatments, patients need to have a genomic test. And to tell us more about genomic tests and what it means for patients, Dr. Neil Iyengar, medical oncologist and researcher with the Breast Cancer Research Foundation, as well as Karen Peterson, a breast cancer patient and advocate. Thank you both for being here. And Karen, let's start with you first. If you can tell us a little bit about your story, your diagnosis, your treatment.
Thank you for having me. In 2017, I was diagnosed with metastatic triple-negative breast cancer. I had tumors in my spine, in my lung, in my ribs, and in my pelvis. It was a devastating diagnosis, and I thought to myself, what am I going to do? How am I going to extend my life? How am I going to stay alive? So I did a little research. Actually, I did a lot of research, which led me to an oncologist who suggested that if I wanted to make an informed decision about my treatment plan, I should get genomic testing. And I was so glad that she did, because the report revealed that my particular cancer, my particular tumor, had mutations. And I used that information to go specifically after a trial that was targeting those mutations. So it was really individualized, it was really personalized, it was an informed decision, and it was really important to have that information at my hand, So it was really important. So if more patients want to know about genomic testing and talk with their healthcare providers about that and, think whether or not that's going to work for them, they should go to testingmycancer.com. Pull the website up, take a look around, and have a conversation with your healthcare provider to see if it would be a useful tool, just like it was for me, in order to, figure out your treatment plan.
So, Dr. Iyengar, what exactly is genomic testing? How does it factor into a patient's treatment?
Genomic testing, as Karen mentioned, is a way to individualize a treatment plan to a specific person. It looks at the DNA or the genes in a cancer cell, and it identifies mutations that might be found specifically in the cancer cell. These are mutations that are not found in the normal healthy cells in our body. And what that allows us to do is pick treatments that target or attack those cancer cells while sparing our normal healthy cells. It allows us to individualize our treatment plan and potentially identify clinical trials of new therapies coming down the pipeline that might be beneficial to that individual.
And is it applicable to all types of cancer?
Genomic testing can be used in all types of cancers, and it can be very helpful across the board. There are some cancers for which it is more helpful, and some stages, like more advanced stage cancers, for which it is more helpful. But it's important that every individual who is diagnosed with cancer has this conversation regarding whether or not genomic testing is the right test for them with their doctor.
Karen, one more time before we go, can you remind people of how they can get more information about this?
Sure. Everyone can go on testingmycancer.com. Take a look around the website. You might be surprised what you learn.
All right, that sounds like really good advice and a really great advance in medicine and medical technology. Thank you both for being with us.
Thank you so much. Thank you.